The population in the nursing home, the vast majority of them are very medically compromised. They may have up to a dozen different medical diagnoses, and they may be taking 12 to 15 different medications. They're also mostly are wheelchair bound. We also have patients who are on ventilators, where of course they're not mobile at all, and we also treat those patients at the nursing home. At Isabella, we're very unique in that we have 3 dental operatories. There are also 4 medical beds, and there are faculty from PNS, from St. Luke's Hospital, treating the medical needs of the patients, in addition to our being there in the 3 operatories. This is very uncommon in a nursing home. Most nursing homes do not have set facilities like Isabella has, and oftentimes they will contract a dentist who may come in for consultations to do the required examinations that whatever state the nursing home is in demand, and that if any definitive treatment is needed, the patient would have to be transported to their dental office. This leads to some complications in that because many of the patients are in wheelchairs, the dental office must be able to accommodate a patient in a large wheelchair. Most states mandate certain procedures that have to be done for the nursing home patient. In New York State in particular, the patient has to have an initial exam within 4 weeks of admission, and then they have to have an annual exam. Other than that, there's very little that's required except for maybe treating emergencies. A practicing dentist could easily consult with their local nursing home. They would have to be credentialed, and they would have to be appointed to the medical staff. There are really 3 points that the dentist would have to consider. In general, the dentist is part of a team that's treating the patient. So there are physicians in the nursing home that are treating the patient. There may be a nurse practitioner service there. There's the nursing staff. And the practicing dentist, number one, would have to diagnose and treatment plan the patient. And then he would have to be very much aware of the medical treatment that his patient is undergoing. And the third thing would be that the treatment plan that the practicing dentist would normally render in his private office may have to be modified for the special needs of the older adult. And those needs are generally whether they're ambulatory or whether they have medical conditions that are going to preclude normal dental procedures. There are many nursing home patients that are very concerned about their appearance. They'll come down to the dental clinic. They'll be very well dressed, very concerned about their appearance, but not smile. And most often you'll find that either they're not happy with their smile or they don't have any teeth. And their biggest concern is for you to do something about that. There's one patient where she didn't want to see her grandchildren until she got her smile. She was just a new admission, and so it wasn't until we were able to finally make her dentures that she invited her grandchildren to come and see her. For a healthy older adult, I put implants in the oldest was 91. And I bleached, I think, an 86-year-old, I think he was 86-year-old, so he could get married. So I mean, age doesn't, it's not the age, it's you know, you're older, but it's how well you can, how medically fit you are, basically, and whether you can walk and that type of thing, talk. There's ample opportunity for the dental student to get involved in dental nursing home care, either through the dental school. There are several programs at Columbia where faculty are out in nursing homes or in at least adult population centers treating or at least examining patients. And even if you feel that you don't want to go that route, you could also volunteer in your local nursing home, especially in the medical aspects of their care. The one aspect that I enjoy the most about treating older patients is the satisfaction that I get in seeing that you actually help somebody, where, especially someone who had difficulty accessing care and has so many complications involved in their getting dental care.